The Copper Corridor Coalition. Our vision is to have a thriving and drug-free Copper Corridor community. Our mission is to empower community members in developing drug-free towns through collaboration, education, and inspire healthy choices. Based in Superior, the Copper Corridor Coalition, or CCC, attracted members from neighboring communities. The Copper Basin Coalition, which is also a drug-free communities coalition from nearby Globe Miami area, assisted the CCC in adhering to the Strategic Prevention Framework. Then consequently, the CCC successfully applied for and secured a drug-free communities grant in 2019. The Copper Corridor is a rural area in Pinal and Gila counties in Arizona made up of 9 small communities: Superior, Kearney, Hayden, Winkleman, Dudleyville, Aravaipa Canyon, Mammoth, San Manuel, and Oracle. The total population of these communities is 15,570. The Copper Corridor is named for the large number of copper mines in the area and is home to one of the largest copper deposits in North America. Approximately 27.3% of the residents are under the age of 20. The current racial and ethnic demographics are 56% white, 23% Hispanic or Latino, 5% Native American, 4% African American, 5% other. The culture in the Copper Corridor is heavily influenced by Mexican heritage, with a large population of descendants from Mexican immigrants who historically worked in copper mines.
What does the NCA mean to me? Well, it means my roadmap to success. Because they share coalition products that we can practically apply in our communities, we've been able to see what was really close to our heart, wanting to help the community reduce substance use and to be able to really be successful in applying prevention efforts.
What does the NCA mean to me? It's my go-to and cheer camp for prevention. It's changed my perspective by giving me confidence in the way I gain partnerships within the communities to become a stronger coalition for prevention.
The 5 products our coalition created under the direction of CADCA really provided an effective way for us to implement prevention strategies that address local conditions. First, in our community assessment, we reviewed our community resources, one of which is our law enforcement agencies and strong community partners. Then we looked at our resource gaps and recognized that it takes as long as an hour for emergency services to arrive on scene. So we needed to find a way to reduce the risk of emergencies in our community and give our law enforcement a tool for prevention. Now this would have a direct impact on reducing the risk of overdoses, drug deals, and even underage drinking in our communities. So we're now helping law enforcement agencies to create a tip line to report suspicious activity before it becomes an emergency. We also reviewed our logic model and quickly saw that we weren't using the 7 strategies for community change for each local condition. For example, are the youth that are sharing vapes in the bathrooms at schools in the Copper Corridor. Well, that was a local condition. We had to go back and ask the youth in a focus group why this was happening. And then we saw that 90% of students were vaping in school bathrooms to cope with school stress, and specifically the stress they felt by being overloaded with school work. So we realized that we needed to provide support in a different way. We needed to utilize school staff to address the problem of students feeling overwhelmed by school work and enhance the skills of the students to build healthy coping skills for stress. This really led us to our strategic and action plan. We needed to rethink who in the coalition would be able to make an impact on the youth vaping in school bathrooms. And of course, it's our youth committee. They now are empowered to take the lead in social media campaigns to really show the dangers of vaping. But they as well created poster contests to motivate their peers to stop vaping and provide them with the resources that they need. Our evaluation plan was effective, but we realized that we needed to create an organized way to get the data from our key informants every year. For example, we use the superintendent and SRO to identify how many youth were caught vaping in school bathrooms in a year. Both superintendents and SROs, they can change in our community. So we were working on a form that can really help to collect data no matter who is used in this position in the future. And this will really enable us to get accurate and consistent data. As we looked at our sustainability plan, to be truly effective at reducing youth vaping, whether that's marijuana or nicotine, we needed to pull really our community partners to create a task force. Now we're currently working with law enforcement, youth, mayors, superintendents, and other organizations that are involved in prevention to create a diversion program, and that helped to change school policy on long-term suspensions to reduce youth vaping. But while we had success in this last year, we recognized more needed to be done. Many youth that we were assisting were self-medicating and perhaps dealing with mental health disorders that they are unaware of. So due to that, we had to bring in the school psychologists to help them gain more access to treatment. An ongoing effort and evaluation of our products will be needed for us to be more effective in our communities. And we're so thankful to CADCA for giving us a foundation to positively impact the lives of youth and families in the Copper Corridor.
Hi, my name is Donald Boyd. I'm a detective with the Superior Police Department, and I'm also the school resource officer for the Superior Unified School District. I work with the Copper Corridor Coalition to implement prevention education within the school district, and we partner on law-related education to help reach the hearts of the students we teach. A key to success for us is implementing these programs is planning to get the most effective engagement out of the students. It has been an enormous privilege to work with the Corrdior Coalition. Without them, I don't think we'd be doing nearly as good of a job as we are now.
Hi, my name is Michael Rubin Castro, and as a member of the Copper Corridor Coalition representing the faith sector, I'd like to share some information about our organization with you. I have seen the coalition grow in their capacity over the years. They have brought in other organizations in the community to support and finance our activities. A good example of this is their summer youth conferences. These are events that usually have police, fire, city governance, judges, local businesses, and community volunteers all coming together to help educate youth and encourage them to make healthy decisions in their lives. In rural communities like ours, we have very few resources, and the opportunity to bring people together to work in support of our youth helps to develop capacity within our communities and healthier families. I'm glad to be a part of this, and I'm thankful for the opportunity to share this information with you.
National Night Out was a great experience for me as a coalition member. In the Copper Corridor area, we have many different cultures coexisting together, and for one night, we nailed it. We got to witness tremendous cultural competency when interacting with our communities and emergency responders.
Hi, my name is Myra Warren with Norms IGA. We are financial support partnering with Copper Corridor Coalition to sustain successful prevention programs for communities, and happy to be a part of it.
The future goals of the coalition is to have all prevention be youth-led. As a youth leader in our coalition, I am excited about this goal to have a positive impact on my peers and make a difference in my community.
Well, we're excited to report that because of the logic model that we're able to create during the academy for youth marijuana use, we're able to implement the 7 effective strategies for community change. And due to that, there's been a 30% reduction in youth getting marijuana from older adults. And we thank the NCA for helping us to do that.